Hello and welcome to our weekly COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth Town Moderator. We're here each Wednesday at noon for this update, which is number 89 today on March 10, 2021. This forum is being brought to you live by PAC TV at Comcast Channel 15 and Verizon Channel 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email us to plymouthinfo@pactv.org. These forums can also be replayed at pactv.org/Plymouth. Today's participants joining Ken Tavares, Matt Muratore, and me include Dr. Mark Wilson, Sarah Cloud, Karen Keane, Dr. Christopher Campbell, Cheryl Botieri, and Stephen Cole. We're going to begin today's presentation with our welcome from the Chair of the Select Board, Ken Tavares. Hello, Ken.
Hello, Steve. Thank you for inviting all of us back again today. As we're observing the 1-year landmark that we have been dealing with the virus, I came across some comments on the internet that I would like to share with the public. Very meaningful words written by Donna Ashworth. And they begin as follows. In 20 years' time, people will not ask the children of 2020 if they caught up with their studies. They will not ask them what grades they made, despite the year off school. They will ask them with wonder, what was it like? Then they will ask them, how did you cope? How did you feel? What do you remember of these days? They will listen and nod to the tales of clapping on doorsteps for the medical workers. They will sit open-mouthed to hear of daily walks being the only life we saw and how much we missed human contact and gatherings. They will be amazed to know about empty supermarkets, online concerts, birthdays spent on a screen, and a life lived inside. They will listen, then sit back with amazement and say, wow, you went through so much. So think about what you would like your children to take away for the whole year. Tell them they are not behind. Tell them they are not missing out. Tell them they are extremely special indeed, and they will be forever made stronger by this unique time. Tell them catching up is not even the thing because they have grown up so much in so many other ways. Remind them of the fun stuff, the family jigsaws, the window rainbows, the Zoom bingo, the feeling of safety and togetherness amidst the chaos. Let them take that thought with them through life. Change the narrative now and it will travel far. Tell the children they are not behind. They are special. They are special. Thank you, Steve.
Thank you. And that's Ken Tavares. He is Chair of the Select Board for the town of Plymouth. You can send your questions, plymouthinfo@pactv.org. Each week we begin our presentation with the medical segment. And today we have 3 participants from the medical and scientific community. First, we welcome back Dr. Mark Wilson. He is an epidemiologist from the town of Plymouth. Welcome, Mark.
Thanks, Steve. Thanks for having us back again. I'd like to spend just a few minutes today on some questions about vaccination against COVID that the viewers might find interesting. And the first one goes as follows. Getting vaccinated is supposed to keep me from becoming sick if I am eventually exposed to the coronavirus, yet I know that I might still be able to infect others. But shouldn't being vaccinated mean that I will transmit less virus, and so others would be less likely to get sick? So that the chance that a vaccinated person could infect someone else partly depends on being exposed after your vaccination or during your vaccination, and then developing what we call a viral load. And very simply, the viral load is the amount of virus in your body, and therefore the amount or concentration of virus that you might spread through the air to other people. And one recent study has shown that people who have been vaccinated but still experienced COVID symptoms had a lower viral load than other non-vaccinated people. So this means that people who who did become infected after being vaccinated, and this is something that's, again, very unlikely, would only be able to transmit less virus to others. As to whether others who are infected with less virus from a vaccinated person are less likely to get sick, the answer is probably yes. However, like so many questions involving COVID transmission or susceptibility or treatment or vaccination, scientists are still actively, even frantically, trying to get answers that we can trust. Most of this is still uncharted ground, but we can use insights from the long history of research on other infectious diseases to help us in these questions. Because it would be unethical to study this by intentionally infecting people to test this idea, epidemiologists are trying to infer risk by monitoring populations of people who have been vaccinated. But it takes time to gather enough strong evidence to change policies. And so for now, it's being recommended that we err on the side of caution and ask vaccinated people to use masks in public. But available evidence suggests that you're much less likely to infect someone once you have been vaccinated. So this issue, in my mind, raises another question that I'd like to address, which is how public perception of the caution and uncertainty of scientists sometimes leads to frustration and mistrust. Scientists, public health scholars, academic experts, and even journalists are trained to be skeptical and cautious. And this has meant that some of the public messages about the COVID vaccines have really presented a lot of uncertainty, a lot of issues around the challenges and the risks. And we're constantly, therefore, being reminded that the coronavirus vaccines are not 100% effective, or the new virus variants could make everything worse, or vaccinated people may still be contagious. But because of this emphasis on all the imperfection and uncertainty, on top of the hassle of trying to get a vaccine, some people have just decided not even to bother. Although this information about the challenges and uncertainties is based on what is known and considered to be true, the message still can be misleading. And even though the experts are encouraging vaccination, discussion in various media sources is often dominated by this focus on the uncertainties and possible problems. And this could be unintentionally feeding anti-vaccine misinformation and anxiety. In fact, evidence so far suggests that all three of the currently available vaccines essentially eliminates COVID deaths, nearly eliminates risk of hospitalization, and severely reduces a person's ability to infect someone else. This is also true for new virus variants. One problem is that these initial vaccine trials were not designed to study many of these questions. They were focused on efficacy and safety. And so scientists are unwilling to recommend policies that are based on high probability and low risk. Until there's enough in the way of trusted answers on many of these questions, we have to, again, err on the side of caution and remind everybody that the vaccine is not a panacea for our problem, even though it's going to have a huge impact on what we're facing today. The public needs to hear that vaccines are highly effective against serious disease. And the emerging evidence about infectiousness of vaccinated people looks really good. And despite these concerns, however, caution and skeptical scientists as we are, we still agree that you should be vaccinated as soon as you are able. Finally, I'm sure that most viewers have heard the recent report from the CDC that recommends people who have been fully vaccinated can now start to interact with others to some extent like before the pandemic. The CDC now considers it safe for vaccinated people to gather indoors with other fully vaccinated people without wearing a mask, or gather indoors with unvaccinated people from one household without wearing a mask, except if someone in that household has a high risk for COVID. However, even if you are vaccinated, in public settings, you should continue to wear a mask, maintain distances, avoid crowds, and don't visit poorly ventilated places. The CDC guidelines raise the question of whether people who have been vaccinated still have to follow state guidelines when traveling between states. And do they still need to be tested or quarantined after returning to Massachusetts, for example? The simple answer is yes, so far. In general, even after being vaccinated, the CDC indicates that state rules still apply and each state's travel guidelines still apply to vaccinated people. When I checked yesterday, actually, the Massachusetts COVID website specifies that even vaccinated individuals must continue to comply with the governor's travel order and related testing and quarantine requirements. Again, let's all err toward caution just a little bit longer. We are quickly approaching a time when much will be back to normal, but it will take a lot longer if we let down our guard too soon. I hope that these brief comments are useful and would be happy to answer questions later on in the broadcast. Thanks.
Thank you, Dr. Mark Wilson. He is Professor Emeritus, an active professor from the University of Michigan School of Public Health, Department of Epidemiology. He's here to answer your questions. Send them to PlymouthInfo@pactv.org. And today, we're also joined once again by Sarah Cloud. She is Director of Behavioral Health at Beth Israel Deaconess here in Plymouth. Now, Sarah, in the past, we've talked about the mental health consequences of the pandemic, and you've been very good about explaining to us. Is that something about which we still need to be concerned?
Yeah, thank you so much for having me again, Steve. And yes, I do think the impact of COVID-19 on our emotional well-being is staggering and will be something that we're going to be dealing with for years and possibly even generations to come. So today I really wanted to revisit the topic of suicide, given the increased risk due to social isolation, anxiety, fear, uncertainty, chronic stress, and increase of economic difficulties. There's so much stigma and shame surrounding suicide that anytime somebody in the public eye speaks openly, like Meghan Markle did this past Sunday in the interview with Oprah, regardless of how you feel about the royal family, I do give her a lot of credit for speaking so openly. And I think it really helps give others permission to acknowledge what they might be dealing with and suffering with silently. So Meghan said in the interview on Sunday that I want to share this because there are so many people who are afraid to voice that they need help. And so if you're having thoughts about feeling empty, hopeless, having no reason to live, thinking about ways to end your life, feeling trapped, or that there are no solutions, please know that you're not alone. Please reach out, talk to somebody you trust. If you are not ready to talk to a family member or open up to a friend, there are confidential programs available, such as Call to Talk. So Call to Talk is a mental health, emotional support, and suicide prevention program run by Mass 211. So it operates 24 hours a day, 7 days a week, and provides confidential, compassionate listening to assist people, including those who may be despondent or considering suicide during stressful times like this. So Call to Talk is a national suicide prevention lifeline crisis center, and it partners also with Crisis Text Line to respond to people via text. So if you don't want to make the phone call, but want to reach out via text, you can do that as well. The text is 508-532-2255. Thank you.
At Beth Israel Deaconess here in Plymouth. She's here to answer your questions as well. As we move on to Karen Keane. Karen is the Director of Public Health for the town of Plymouth. Welcome back, Karen.
Thanks, Steve. Today, what I thought I would do is I would take a moment to answer some frequently asked questions that we receive here at the Department of Public Health. So here it goes. Who has received the vaccine so far in the town of Plymouth? Well, the town worked with Brewster Ambulance to vaccinate our police, our fire, our other first responders, all of our school nurses, our Meals on Wheels drivers, senior housing, veterans, and current living areas. Currently, The people who can qualify for the vaccine at the vaccine sites that are listed on mass.gov are people who are 75 plus, 65 plus, individuals with 2 or more certain medical conditions, and starting tomorrow on March 11th, K to 12 teachers, child care workers, and school staff. And the state wants to make sure that we understand that child care workers does not include babysitters. These are people that actually take care of children that's their living, that's their employment. Is there still a mask order for downtown and the waterfront? Absolutely. And especially now that the weather is getting warmer and it's nice out again and people are walking around more, a mask is required while walking or sitting at the waterfront or in the downtown area. Do I have to comply with the travel order if I've received the COVID-19 vaccine? Yes. It's important to continue using all tools available to us to stop the pandemic, which is quarantining, wearing your mask, social distancing, and washing your hands. Can there be indoor singing? Not yet. However, yes, if it's a school, schools are allowed indoor singing, but the singers must wear a mask and must be at least 10 feet apart. Religious ceremonies can have singing, but all other singing, including St. Patrick's Day songs, must be sung outside. I need help with making an appointment to receive the vaccine. Okay, if you qualify for the vaccine and you do not have access to the internet, you can either call 211 or call 877-211-6277. That phone number is available 24/7, 24 hours a day, 7 days a week. The call is free, and there are also interpreter services available. Again, can I have live music outside of my establishment? Can people sing outside? Yes, they can sing outside as long as there is 10 feet between performers and 25 feet between performers and the first row of the audience. It's important to note, you cannot use plexiglass barriers to reduce the required distance. Do I need insurance to be vaccinated? No. No one can be denied the vaccine regardless of current insurance status. However, vaccination providers may request insurance information from those who have it. Does the town department and/or board have any jurisdiction over the state guidelines? Yes. However, only to make the guidelines more strict. The town, the department, and the board cannot weaken the guidelines. So in the example of singing inside, we can't, as a board or a department, or even as a town, say, well, you know what, we're not going to follow that one. We're going to say that singing is allowed inside. We can't do that. We can make them stricter, but we cannot make them weaker. I've had COVID. Should I still get the vaccine? Yes. That will protect, continue protection for yourself and also for others. I am currently COVID-19 positive. Can I get the vaccine? No. You should wait until your isolation period is over, which is usually 10 days after your symptoms start, or if you haven't had any symptoms, 10 days after your positive test. Do I have to follow the travel order if I've received a COVID vaccine? Now, this is brand new, Mr. Wilson, hot off the presses. If you have received your second dose of Moderna or Pfizer, or 1 dose of Janssen, which is the 1 dose product from Johnson & Johnson, and it's been more than 14 days and you have no symptoms, you do not have to have a negative test or quarantine when you arrive back to Massachusetts. Do I have to quarantine after I've been vaccinated if I'm identified as a close contact to someone with COVID-19? That's interesting. Nope. If you've received 2 doses of Moderna or Pfizer and 1 dose of Janssen more than 14 days ago, then you are not required to quarantine following an exposure. So those are some of the most popular questions that we were receiving in the department lately. And I thought I would just take this time to answer some of them, because I think if people are taking the time to call, there's probably more people out in the audience who are also wondering the same things. Thanks, Steve.
Thank you, Karen Keane. She is the Director of Public Health for the town of Plymouth. She's here to answer your questions, as are all our panelists. Email us at plymouthinfo@pactv.org. We now move to our education segment. We welcome back the Superintendent of Plymouth Public Schools, Dr. Christopher Campbell. Chris, a lot has happened since the last time you were here. Most important would be vaccines are now available for people who work in the Plymouth Public Schools. What do you have for us today?
Yes, yeah, thanks, Steve. Thanks for having me. Yes, lots to share, lots of good news, really. So while we still continue to have some cases among students, our weekly reports are better than they've been since early December, which is very encouraging. We begin to return students full time and are evaluating our recommendations for secondary students on Monday night. Teachers are part of the vaccination cycle, as you just said, and have already been able to get appointments. So lots of good news to share today. So last Friday at the State Board of Education meeting, the board approved by an 8-3 vote the commissioner's recommendation to further amend the student learning time regulations, which I've spoken to about on this show before, multiple times, I believe. These regulations essentially dictate how many days and hours must be met minimally by grade levels in schools with teachers for school districts. So this further amendment extends the authority of the commissioner to determine when hybrid and remote models will no longer constitute structured learning time, and districts must return students to in-person instruction, which we've already started planning for. Districts that don't meet the requirements would be forced to either seek a waiver or to meet, extend the year in some way, shape, or form. So the commissioner now has the authority to make determinations, what he calls in whole or in part. So in other words, he may use a phased-in approach, which determines whether a hybrid or remote model will no longer be used to meet learning time at the elementary level, and then make subsequent determinations for middle school and high school, which he recently has. So for the remainder of the school year, it's important to note, parents and guardians to know that they may continue to select a remote learning model for their children. So if they've been in a remote model, that will not be taken away. The learning hours for students who are in remote will continue to count as structured learning time, but for districts, they would not. The commissioner stated that he's going to pursue a gradual approach to returning students in the classroom. Our elementary students will return to full person instruction 5 days a week on Monday, March 29th, and I will be making recommendations for our middle school and high schools this Monday evening coming up at our school committee meeting. So more to follow on that. CVS vaccines have been rolling out to teachers since early March. I'm happy to report that many of our educators have either already received their initial vaccine or have been scheduled to receive their vaccine through CVS pharmacy. And now with the state opening up and actually having dedicated days on many Saturdays for educators, I think this will only speed that up as well. So as you may know, President Biden urged states to vaccinate teachers and school staff, and he called on them to provide at least 1 dose to every teacher and staff member by the end of the month. He also said that he would use federal pharmacy partnership programs to make shots accessible to teachers. So while the Massachusetts rollout of vaccines begins tomorrow effectively, pharmacies such as CVS got to work on this immediately through that partnership, and we're able to get appointments for many of our staff. So really good news there. Our buildings are being set up and prepared for students' full return. So classroom furniture has been set up. Larger furniture has been stored in, that was previously stored in cafeterias is being moved to temporary storage. There are certain furniture that we just can't fit in classrooms due to the restrictions. We've met with principals many times to review all the logistical concerns, and I feel very confident that our schools will be well prepared for our students' eventual return. So related to that, an additional survey was sent out to families and to our high school students as well on Monday. So as we evaluate the conditions and make further recommendations for our secondary return to school, we really want to hear from our families, our staff, and our students, any questions, concerns, and suggestions that they may have so that we can use that feedback to guide the important decisions for the remainder of the school year. So we ask everyone to please complete that survey no later than tomorrow, March 11th. A letter went home to our elementary families about a week ago, highlighting our return plan for the 29th. And as we transition to include more students in the classroom, there will be certain new conditions for our elementary students. So first, all students K-5 will be required to wear masks that properly fit and cover their nose and mouth. So up until this time, kindergarten and first grade has been optional when you're at 6 feet in the classroom with students, but we are as we move forward, we're going to be changing that and requiring all K-5 students wear a mask that's properly fitted around the nose and mouth. This is something that the majority of our students have been doing since day one, but it will be an official mandate. We also will not be allowing the use of gaiters. Those will not be permitted. So if students would like to wear a gaiter over their mask, that would be perfectly acceptable. However, we want to make sure that our students are wearing a properly fitted mask. And we all know that according to the CDC and health experts, the mask wearing has been really proven to be the most effective mitigation against the virus. So with students now being in closer proximity to one another, we feel that this measure will continue to support the success that we've had in our schools since the beginning of the year. And if families need assistance acquiring a properly fitted mask, particularly for our little ones, we have plenty of masks, child-sized masks in our schools, and we're happy to share those. I just encourage families at the elementary level, Monday, March 22nd, we will be hosting our second round of parent-teacher conferences, and this is just a great time, really a great opportunity to talk with teachers about what your children may be experiencing. These short meetings also give families and teachers a chance to discuss really important student learning outside of the classroom, as well as any concerns they may have as we transition them back. So just a great opportunity as we approach the final months of the school year to get some feedback. In the coming days, our principals will reach out to families to communicate specific logistics to all of our elementary families regarding their buildings. Some of them have very specific logistics, so because of the configuration of their building. But just ask if you have any questions, please reach out to your administration with any specific questions, but you will be hearing from them very, very soon if you haven't already. Lastly, I just want to take a moment to assure the public that we have done everything, and I mean everything, recommended by the CDC and the Department of Education related to ventilation, cleaning, sanitization, and air filtration. And if there's anyone, any family, or anyone in the school community really that has any questions related to that, I'd encourage them to contact my office, our school administration, or our director of facilities. And as I said at the beginning, we're very optimistic about how things are progressing in the district in terms of our health metric, and I'm really looking forward to the full return of our students. So thanks, Steve.
Thank you. That's Dr. Christopher Campbell. He is the superintendent for Plymouth Public Schools. And at this time, we welcome back Cheryl Botieri, and she is an end-of-life family support specialist. Welcome, Cheryl.
Hi, everyone. Thanks for having me, Steve. Yeah, so I'm here to really kind of start and kick off National Healthcare Decisions Day. So each year on April 16th, that is something that has been happening since probably around 2008. And really this initiative is to help inspire people and help people to become informed and empowered to really think about advanced care planning. And certainly with COVID this past year, this has really come front and center, that serious illness and things just can happen. And we plan for a lot of things, but most of us don't plan for these unpleasant things. And so National Healthcare Decisions Day this year is really focusing on having these conversations, having these difficult conversations, so that we can know from our loved ones, what might your wishes be if something serious like an illness like COVID happens to you? The kind of theme around National Healthcare Decisions Day really is your decisions matter and your choices matter. And often we don't even know what the choices might be that we have. And that's another thing that COVID has really shown many of us, is that we're unprepared. And it really is not something just for seniors to do end of life planning. And I know that might sound a little bit morbid, but really it's about how can we live our best possible lives for as long as we can, or maybe not as long, but within the number of days or times or years that we have. I always tell everybody, did you have a birthday last year? Congratulations. Guess what? You're aging. You're on that roller coaster. And for many of us, we want to live full life, meaningful lives, but accidents and illness does happen. So I'm encouraging everyone this National Healthcare Decisions Day season, if you will, the month of April, to really start to think about those things. So we're pushing, having the conversation, and we're working with B.I.D Plymouth because they have this curriculum through the Conversation Project that they use. It's something I use in my practice. And there's a lot of resources that here locally we're going to be sharing through PAC TV, through Wicked Local. So there'll be more rolling out, but we really want to get those conversations starting. So with the Center for Active Living, I'll be working on a couple of programming ideas for them. We'll be sharing information and again, different resources. But there's a few things we want you to do starting today. We want you to start to think about what matters to you most, or to start thinking about that with maybe some of your friends, your families, your partners, and then start to maybe learn. And so there will be many opportunities for folks to gain some insight and for information and to see what decisions might you make if perhaps you could not communicate your wishes to someone. So think, maybe learn a little bit about what those choices are, and then talk, have those conversations. I know in my family, we are going to be having some death dinners that we're going to talk about death over dinner. We are going to start talking about what it is that my husband and I are thinking about as we're getting into that aging lifespan, and have some conversations with our young adults about, God forbid, if something should happen, what might they choose and who might their person be? And so the next step after you talk about it is write it down. Advanced care directives, there's a number of resources. We will be sharing some websites and then some opportunities to talk about it locally as a community. And lastly, you must share them. You want to talk with your healthcare providers. You want to talk with your friends, your loved ones, who matters most to you that you're going to share this personal information or your wishes. So you need to make sure that you share that with somebody. And every April 16th will be National Healthcare Decision Day. And you might say, now, why did they choose that date? Well, it's the day after tax day. And from that saying long ago, one thing that you can count on is taxes and death, or death and taxes. That's why. So a little tongue in cheek with that. So if this year we can get you started, National Healthcare Decisions Day is on a Friday. So over the course of April 12th through the 16th, we're going to be releasing lots of information and opportunities to get these conversations in our community happening, with lots of resources and people that can help you to plan and to have some of these conversations. So we do have a slide with a little bit of information. So I think we might bring that up. And certainly please reach out to PAC TV, to Cal, if you need a little bit more follow-up information. We'd be glad to get you whatever we have. Thanks again.
Thank you, and that's Cheryl Botieri. She'll be here to answer your questions. She is an end-of-life family support specialist. At this time, we're going to move on to our business segment. We welcome back Stephen Cole. He's the Executive Director for the Plymouth Regional Economic Development Foundation. Welcome, Steve.
Hi, Steve. Glad to be back. Thanks for having me. You're getting really good at saying our name fluently, I might say. I want to share with you guys some of the updates in the unemployment numbers, as I'm apt to do. Unemployment in Plymouth, the town of Plymouth, as of 2/20 is 4.7%. That's a slight uptick in the last time I was here. Last time I was here was 3.8%. That number, 4.7, represents about 1,500 people in our community. Remember, though, we were at a high of 18.5% during last summer in April and May. So we've made great progress. But We were at 2.8% when this whole pandemic started. So we have some way to go still. For the county number is 4.6%. However, that represents 13,000 people in our county who are looking for a job. Now, this sounds like mixed bag. It's not great, but it does demonstrate that we are moving in the right direction. Yesterday, the state made an announcement that they believe that 250,000 jobs have been permanently lost. Frankly, I believe that we will regain that the job activity, but I don't think we'll get there by scaling up. Frankly, I think entrepreneurs will be the ones who will fill these gaps. New businesses will create new jobs to replace the lost ones. A recent survey that I shared with my board recently that shows what corporate developers are looking for as they are getting back into 2021 and as they start and grow. I won't go through the whole list, but I am very encouraged by a number of the things that do appear on the list because Plymouth checks a lot of these boxes. The top 4 are things like skilled labor, which we have, highway access, which we certainly have, access to major markets and ports, which we certainly have between Providence and Boston. But what's more, number 4 on the list, and this is reported by 85% of people who are looking to establish their business in a place. They're looking for quality of life. And so you can say whatever you want about Plymouth and all of those other categories, we certainly have them, but quality of life, I think, is something that we can talk about superlatively. We are well positioned to attract this type of corporate investment. We just need to let them know that we're here and that we offer those things to them. So the foundation is working with not just our board members, but also some partners to create a messaging strategy so that we can tell these developers that we're here, we're open for business, and we welcome them. We meet some of the things that they're looking for. Some of the other things that I want to talk about too are simply what the foundation is doing to support entrepreneurship. We have right now in the field a RFP. We'll be selecting a vendor to conduct a study. That study will tell us largely what is our entrepreneurial profile here in Plymouth County, and maybe also looking a little toward Barnstable County where we might fill in some of the gaps from folks there. So what I expect is that by the end of summer, we'll have in place an implementation strategy that speaks to who we have here as entrepreneurs, who we think we can attract, given the assets and the skills that we have here. But what's more, what can we do at the foundation level and as a community to fill the gaps to attract even different types of? And I'll pause here just to simply say, entrepreneurs aren't necessarily a cookie cutter dynamic. There's lots of types. And what's more, arts sector in our region is very important. Something that the Mass Cultural Council announced recently was that 30,000 jobs have been impacted in Massachusetts in the arts sector. It sounds like a lot of jobs, but let me put in another number, $588 million in lost activity. Let me say that a different way. That's $500 million. We've lost $500 million in economic activity just in the arts sector. So artists can be small business owners, artists can be entrepreneurs. Entrepreneurs is a term that you'll be hearing me use a lot. So the foundation is putting up not just staff resources, but also some funding to ensure that the Plymouth region is well positioned to attract the type of investment that we expect to see in the marketplace during the 2021 recovery. Thank you, Steve. Appreciate the opportunity. I'm glad to answer any questions.
Thank you, Stephen Cole, Executive Director, Plymouth Regional Economic Development Foundation. Next week's lineup is going to include Dr. Philip Triffletti, Dr. Barry Potvin, Dr. Stacy Rogers, Michelle Brady, Heather Crosby, Michael Jackman, and the business segment with Amy Naples. And it'll be on St. Patrick's Day. And hosting our presentation next week will be our own Plymouth State Representative, Matthew Muratore. I understand it'll be very special since he'll be dressed as a leprechaun. Welcome, Matt.
Fat chance of that happening, Steve. And maybe I'll wear a green tie. That may be the extent of my leprechaun. So, but yeah, looking forward to hosting next week. And I really enjoy these formats. And I know next week will be the 90th show, which is really, really hard to believe. And I appreciate all the guests that are on today. And I got to say, Steve, I think, listening to Cheryl and Sarah, on their discussions today, they must be a barrel of fun at a dinner party, just to hear conversations. But they're really important conversations. I really don't want to make light of it. They're really important conversations for people to have. And I think more and more people are having that. And I think you're seeing it, Steve, as well with your practice. I know my wife's practice as well is more and more people are having those conversations. They are doing more wills and trusts. And, so you see people doing that and getting their plans out now. So, another good thing that has come from the pandemic is people are thinking of that more and helping to plan for the future. And I think people, with the with getting help for suicide, for mental health. Having telehealth has been a tremendous advantage for that as well. So, so there's always some good things that come out of bad things. So let's start with, I just finished watching the governor's press conference. He just finished. He started off very emotional. As you know, this is the 1-year anniversary of the declaring the state of emergency. It's hard to believe 1 year has passed. And like I said, next week will be our 90th show that we've done, and we're still continuing. One of the biggest things that came out of the press conference was there is a new pre-registration system for vaccines starting on Friday. It will be a form that you can fill out with your personal data, your contact information, and your criteria, and then you'll be notified. Some people will get back to you. You'll either get an email back or a call back or a text back, whatever you prefer when you're pre-registering for your vaccination. So that will start as of Friday. So tomorrow, Thursday, will be the last day for people to go on the mad rush on Thursday morning to go try to book a vaccine. Tomorrow, there'll be about 40,000 first doses that will be available on the site. We still have, hundreds of thousands of people to get through this section of this phase 2, but we will get there. But tomorrow will be the last day for that, and then after that, starting Friday, pre-register for the vaccination, and people, you'll get notified ahead of time, 24 hours ahead of time. You'll get notified for appointments, and you can go ahead and book an appointment. So you'll get all that information starting on Friday. And as Superintendent Campbell, Dr. Campbell brought up about the educators, there are going to be special days for educators to be vaccinated. Those are going to be Saturday, March 27th, Saturday, April 3rd, and Saturday and Sunday, April 10th and 11th. And those will be at the 7 mass vaccination sites. There'll be about 20 to 25,000 doses available for teachers on those particular Saturdays. Right now, we also found out too that the number of doses, about 150,000 that we're getting from the federal government on a weekly basis, will be that for the rest of this month. We will not see any more doses until April. So we'll continue on this line of vaccinating folks on a weekly basis. Right now, we're into a lot of second doses. So most of the 150,000 that comes in goes to the second doses of the people that were already received their first dose. So we expect to get through this section, this phase, with a plus 65 and teachers sometime by mid-April, depending on the supply of vaccines that we should get. Of the 150,000, the mass vaccination sites will get about 80,000 of those. The hospitals get just about that amount as well. And then the regional collaboratives get about 40,000 of those. So in addition, the CVS pharmacies, they're getting about 95,000 first doses from the federal program. So that's going to continue on as well. So the total amount that comes to Massachusetts is about 250,000. So we'll continue to work through the process, but that's good news on the registration site that will help alleviate some of the concerns that were happening over the last several weeks. Tomorrow, for those in the business community, tomorrow we are going to be in session on the House, and the Senate, I believe, is in session as well. And we're going to be taking up a bill that will give a tax credit for unemployed workers whose household income are 200% of the poverty level. We're going to be talking about passing a bill that will have pay 40 hours of COVID sick leave for full-time employees. We are going to have, we're going to waive the PPP 5% state tax on the 2020 PPP loan money that came in. And we're going to waive some penalties for any missed tax payments on the unemployments received in 2020 as well. Excuse me. In addition, we are going to look at, I think I mentioned on last week's show, Steve, that the amount of unemployment dollars we paid out in 2020 is equivalent to 15 years worth of unemployment. So we're looking to borrow about $7 billion and pay it in a small interest rate to pay down that amount of money that is owed back into the system. So we're looking to freeze any tax increases on unemployment for businesses for 2020 and 2021. So there's some good news coming out tomorrow as well. With regard to the numbers, the COVID cases are a little over 561,000 at this point since we started a year ago, and the deaths are a little over 16,000. Our positivity rate still remaining very low at 1.74%. We have a little over 700 people in the hospital in the Commonwealth and about 185 people in ICUs in the Commonwealth. With regard to the vaccine, overall, we are number 7 in the entire country for distribution of vaccines for all states. And for those states that are over 5 million people, we are number 1 in the distribution of vaccination. Right now, first dose of vaccinations is close to 760,000 people have received a first dose. I'm sorry, fully vaccinated, 760,000 are fully vaccinated. And the first dose is 1.47 million first doses have been given. So the total amount of vaccines we received to date is 2.593 million, and doses given is 2.229 million. We also announced today that the Stop the Spread program will continue. That program for testing was supposed to expire at the end of March, but that's going to go now till June 30th. There are 35 sites that will be continuing to remain open for testing, because testing is still very important to conduct. And with regard to I just want to give a quick update on the fully vaccinated folks who are over the age of 75. That's 191,000, which is a pretty good number. And those those having the first dose are 171,000. So we're really doing a pretty good job of protecting our seniors with this vaccination. And I know Karen talked about it, what happens after, you have it for 2 weeks and all that. So this is really a good sign, because remember, these are the folks that we wanted to preserve life for, the senior population, those that are more vulnerable to getting COVID. So that's good to hear. And with those between the ages of 65 and 74, there's been 75,000 folks who've been fully vaccinated, with another 245,000 that have had their first dose. So all is going well with that. And with that, Steve, I will end my update for today.
Thank you, Matt Muratore, Plymouth State Representative. Last year, as a result of the pandemic, Matt co-sponsored legislation to allow remote participation for representative town meeting. And because of that legislation, Plymouth once again will have a virtual town meeting coming up in a few weeks on Saturday, April 3rd at 8 a.m. In preparation for that, there are a number of virtual planning meetings that have been made possible with the cooperation of PAC TV. You can mark your calendars beginning next Monday, March 15th. There will be a training for new town meeting members. We have several, and that'll be hosted by Assistant Moderator Nicole Manfredi with the support of Mark McKinley from PAC TV. The following Monday, I will once again be hosting a presentation night beginning at 6 p.m. on March 22nd, and that's with the cooperation of Donna Rodriguez, who is coordinating that with PAC TV. Also, we'll be returning again on Wednesday, March 24th at 6 p.m. for a preview of all of the motions that will be brought forward at Plymouth Town Meeting. So a lot going on, and again, it's going to be virtual because that will be safe and healthy for not only our town meeting members, but for all of the others who will be participating at Plymouth Town Meeting. At this time, we're going to circle back to our panel for their closing statements. We're going to begin with Dr. Mark Wilson. Mark, what do you have for us today?
Well, I guess one thought I had was we often hear about the light at the end of the tunnel, and I actually think that when we get there, a lot will be familiar, but it's going to be a different new normal. And I think much of what will be new will actually be better. We learned today that there are many resources for our citizens, including help if you are experiencing mental health issues, having trouble getting a vaccination appointment, need help planning for advanced health care, different ways that the school system is bringing students back safely and so forth. And I'm just really thankful that there's so many caring and knowledgeable people in our community who are helping us all to get through the pandemic. together. Thanks.
Thank you, Dr. Mark Wilson. We're now going to go back to Sarah Cloud. Sarah, what will be a takeaway today? A lot going on, and certainly there's, in addition to mental health challenges, even people with suicidal ideation.
Yeah. So I think we're living in a time when emotional distress is a common reaction to what's occurring in our world. So feelings of anxiety, depression, hopelessness, thoughts of suicide are all normal and to be expected. And despite it being normal, suicide, which is complicated and can be tragic, is often preventable. So suicide is the 10th leading cause of death in the United States, largely due to the stigma and shame that's surrounded by it. So it doesn't need to be this way. It's okay to experience, it's okay to talk about, and it's really okay to ask for help. Knowing how to get help can really save lives, and there is hope, as we heard about today. A lot of things are looking up, and great things are on the horizon. So please reach out and ask for hope. You're not alone. Thank you.
Thank you, Sarah Cloud. And Sarah, my wife's a clinician, and I've been at a few gatherings with her, and you guys are great at gatherings, despite what Matt mentioned. So thanks for all of your support. Karen Keane, you're the Director of Public Health for the town of Plymouth. What's a good takeaway for today?
Thanks, Steve. Well, I certainly, on this year anniversary, want to recognize loss of life, financial loss, and also emotional upheaval that the coronavirus has caused. However, I also want to point out a couple of things. Currently in the town of Plymouth, which has around 63,000 residents, we have 95 active cases of COVID. So I would say that's, no one wants to have COVID. I would like that number to be 0, but I think today at 95, that's something that we can truly appreciate, that number has decreased so much. Also, I would be remiss in my duties as the Department of Public Health Director if on this anniversary, I didn't take one quick second to recognize my staff. We're a small group. There's only 4 of us at the Department of Public Health. And these people, Karen Kelleher, my health agent, Rachel Milroy, my health technician, and Margaret Coe, my administrative assistant, have taken on not only their roles where they were hired for, but additional roles that were just necessary when coronavirus came here to Plymouth. So I just want to take a second to thank them and to thank all our residents and our visitors who continue to do what they need to do to stop this virus. Wear your mask, social distance, wash your hands, get vaccinated. Thanks, Steve.
Thank you, Karen Keane, and also thanks to your staff and all that you all do for the town of Plymouth as we respond to this COVID-19. Dr. Christopher Campbell, I know that administrators, teachers, and other school personnel have had some anxiety about lack of vaccination. So certainly all of this news you bring to us today has to be comforting and good for the morale for your staff.
Yes, Steve, it actually has. It's been very comforting and I think very optimistic, and certainly see that in the schools. So, and again, thanks for always having me on the show. I appreciate it. You know, as Mr. Tavares pointed out at the start of the show, this Friday for us will mark the anniversary of when we closed our doors due to this pandemic. And we've learned a lot about the virus over the past year, not only as a country, but as a school system and as school systems. And I just want to extend my appreciation for our families, for the tremendous support and patience that they have shown our district during this time. I realize that we don't always satisfy everyone with our decisions and our actions. However, I feel that we've tried our best to follow the science, follow the direction of our state and local health officials, and really make collaborative decisions where in the best interest of everyone involved. Sort of echoing with what Karen was saying, I can't say enough how appreciative I am for the support of our local Board of Health, Dr. Plotford and Karen Keane as the Director of Public Health. You've been tremendous, and I really appreciate your support all year. Lastly, if there are any families, again, that haven't completed the most recent survey but want to provide some additional feedback, please, we just encourage you to do so by tomorrow. We really want to take everything into consideration and support anything feasible we can as we transition our students back to school more frequently. If you can't find that survey that was forwarded to you, again, please reach out to your school principal and they'll make sure that you receive an electronic copy. So thanks again, Steve.
Thank you, Dr. Christopher Campbell. He is the Superintendent, Plymouth Public Schools. And as we return back to Cheryl Botieri, Cheryl, Representative Muratore reminded us that those of us in the practice of estate planning have seen an increase since the pandemic. And it's interesting when I talk to people about documents for while they're alive, a durable power of attorney, or a healthcare proxy. I used to use the example of, what are you going to do if you're in a car accident? Unfortunately, with the pandemic, now the example would be, what if you get COVID and you're on a ventilator? So what do you have as a something for people to remember from this program?
Well, I think the biggest thing is that even in dire times, there are choices that we have some control over. And you have more of that if you plan ahead, if you talk about those things. None of us could ever have imagined what we've all lived through this past year. And so I think that that is something that has been very difficult, but as with all difficult things, we also learn. And so I think with National Healthcare Decision Day, this is an opportunity for us to learn and for us to look and say, what perhaps had I wished I had talked about my loved one with, because I didn't know what to say or do to help my loved one. I couldn't be with my loved one. What would each of us want to happen in those circumstances? And so going forward, that is something that we've learned. And so with National Healthcare Decision Day, this is a time that there are going to be opportunities to learn. There's going to be encouragement to talk about these things openly and not in as depressive a way. And those of us that work with end of life really know how meaningful and at times how comforting it can be for both yourself and your loved one to know what those choices might be. So.
Thank you, Cheryl Botieri. She is an end-of-life family support specialist from the town of Plymouth. At this time, we return to Stephen Cole. He is Executive Director, Plymouth Regional Economic Development Foundation. Steve, your closing thoughts.
Sure. So just to build on some of the things I mentioned earlier, the U.S. Census Bureau is now starting to release some of the information they gained over the last year in the census. Now, year over year, this time last year, what they reported is that entrepreneurial spirit seems to be alive and well in the United States. They're reporting 50% increase in the number of business license applications in Massachusetts alone from this time last year, and a 73% increase in the nation year over year. So I'll just end with this, Steve, as I have in the past. If you have an idea to start a business, you're in good company. Please reach out to the foundation. We'll be glad to help.
Thank you, Stephen Cole, Executive Director, Plymouth Regional Economic Development Foundation. And we're going to circle back now to Plymouth State Representative Matthew Muratore. Matt, what do you have for us?
Well, as I said earlier, a lot of good things are coming out of, a pandemic, and you can always learn from it. And today was yesterday, 85,000 doses were given of the vaccine, which is the highest amount we've given in 1 day period. And that's only going to go up as we continue to get more vaccines from the federal government. We currently have 170 sites in Massachusetts, and we have the capacity to do so much more, hundreds of thousands more per day, if we just get the vaccine. So we're looking forward to April and getting more vaccines into the arms of people. Another thing I just wanted to bring up, Steve, this Friday, March 12th from 2 to 5 at the Plymouth Public Library, the Cape Cod Military Support Foundation, in partnership with myself, Representative Zaros, Representative Muratore, and Senator Sue Moran, who's really coordinated this whole thing, are going to be giving out food, that will include boxes of food that includes fruits, vegetables, dairy products, to the local nursing home and long-term care employees. Similar to what happened at B.I.D. Plymouth a couple of weeks ago, this is going to take into account every employee that has worked at our 4 nursing homes, our 4 assisted livings, and our rest home here in Plymouth, to come by and just as a thanks, to say thank you for what you have done. You are true heroes of what you've done. It's just amazing work that they have done, and we can't forget those things. We just can't forget those things. It's the small things that mean a lot to people like that. So I hope the staff of all those facilities will come out, hear the congratulations and thanks from all of us to them, and get their food for their family.
Thank you, Plymouth State Representative Matthew Muratore. And now as we return back to our chair of the select board, Ken Tavares. Ken, you weren't with us last week, but we know that you were at Gillette getting your second vaccine. How do you feel?
Actually, I feel great. There was nothing but a sore arm that came after the shot, so I feel very blessed and encourage everyone that can to make those appointments and get vaccinated when it's made available to you and your group is called. But Steve, I also would like to note that this year has been like no other that any of us have lived through. It's come with its triumphs and it's come with its sadness. Very soon, we're going to be charged as the storytellers, and we're going to have to pass the information on to others as to what we experienced and how we got through it. There is much work to be done, but I am confident more than ever that this community is up to it and we are going to defeat this virus. Thank you.
Thank you, and that's Ken Tavares, and he is chair of the Plymouth Select Board. Again, please join us each and every Wednesday. Next week, this forum will be hosted by Plymouth State Representative Matthew Muratore. Today, I'm Steve Triffletti, Plymouth Town Moderator. Thank you and good day.